I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
Today we're talking about menopause. In the first half of the show, we talked about what to expect during menopause, gave you a few tips. Now we're going to talk about things you can actually do, things you should be doing anyway for your health, but also going to be helpful through menopause, and certain supplements, and we're going to go through phase 1, phase 2, and phase 3 of things you can do. If you've had a hysterectomy, you still have to go through menopause. If you had the ovaries not removed, and again, we can do tests for that. I'll talk about some tests you can do for that as well. We can do a cycling hormone test at our office, and that's for women that are premenopausal. And because sometimes women will say, I have hormone issues, and we can do a hormone test as well. And we can also do a perimenopausal test as well. And so these are some tests that we offer at our office to determine where you are, and then we can give you specific recommendations. Again, whenever I do a show, it's always general recommendations, and then we need to fine-tune it for you. And that's why I do recommend, if you have a health issue, come see us. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. Just come see us. It makes life a lot easier. What'll happen is every now and then patients will send me questions through the website. I'm more than happy to answer them. But after about the third or fourth question, I say, listen, you got too much going on. You just need to come see us. Hormone therapy may be okay, but we're going to talk about how you can get your own hormones produced. I'd rather you get hormones from an endogenous source inside your body than an exogenous source outside the body. If you have to do it outside the body, I support that, but let's do everything we can first before we have to start turning to medication. I always say chiropractic and nutrition first, drugs second, surgery last. It's the most effective, least expensive treatment. It's the least damaging, lowest risk, so why wouldn't you go that way? I don't know why people don't go that way. Medical conditions sometimes do respond to hormone therapies, but lifestyle changes. Let's do this first. Weight loss, got to do it. Go to our website, drjoe.com, type in weight loss. We've done shows on it before. I also recommend putting you on a 21-day weight loss jumpstart. It's on the website, and that kind of gets you jump-starting, kind of resets your brain, because if you're like me, once you start eating sugar, you can't stop eating sugar. Once you eat bread, you can't stop eating bread. Once you start eating fat, you can't stop eating fats. So we kind of reset your brain, and then we go into phase 2. So it's not just a here's your diet. No, let's get the brain working properly first. Exercise, of course, room temperature reductions. It's an issue. I know one of my producers was just here in the studio, and he was talking about his sister. He goes, when she comes to visit, it's like an ice box in his house. So, yeah, that could be an issue as well. But you got to have people you got to explain to people, listen, this is what's going on. This is what we need to do to work together with this. We talked about that in the first half of the show. Avoid the foods that aggravate the symptoms. What are they? They're the 7 deadly sins. Alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Those 7 deadly sins, I'm so glad I came up with them 20, 30 years ago, because they're the core of the things you need to avoid. When you start avoiding them a lot, and then you start eating good foods, the body usually does well. And of course, dressing in layers if you do have the hot flashes. One of the things we talked about earlier is vaginal dryness. This is something that patients talk to me a lot about as they go through menopause. It's not uncommon. Estrogen levels drop, vaginal dryness occurs. Extra virgin organic coconut oil works very well. It's a natural lubricant. I have to laugh because you can buy these lubricants, and many of them have hormone-disrupting chemicals like parabens in them. So your hormones are whacked out anyway, or changing. I shouldn't say whacked out. It's a normal process. And then you're putting hormone-disrupting chemicals in a very sensitive part of your body where it can easily be absorbed into the blood system. So extra virgin organic coconut oil is probably going to be your best bet. Olive oil would probably work as well. Extra virgin olive oil, avocado oil, but only the good healthy oils. I wouldn't use peanut oil or vegetable oils. They're high in omega-6 fatty acids, which can increase inflammation. And many times things like corn oil and soy oil are genetically modified. So that's a whole nother lecture. But the healthy oils that we talk about eating can also be used as lubricants, and that may solve that problem for the vaginal dryness. So let's go through some quick things you can do. Once again, I said it is not a disease. It's a natural process. And there are things you can do to deal with this natural process that help your body get through them. So, surefire strategies. Everybody wants a quick fix. Everybody says to me, Dr. Joe, I need this done yesterday. I understand that, but it's going to take some time. We're going to go through some changes in our lives, whether you want to lose weight or feel better or get your bowels working properly or get rid of neck pain and back pain and shoulder pain and headaches. Chiropractic care is sometimes one adjustment. I mean, I have patients every day. We see them for the first time in our offices, and as they're walking out, sometimes they're in tears. I can't believe I feel so good. It takes time to do the repair work, though. Same thing with dealing with hormones. I tell people to give up bad foods for one day. They'll say, Doc, I feel great. Okay, now let's do it for long term to make this a normal part of your body. It's not what a healthy lifestyle change is all about. There is no one and done. I have a headache, I take an aspirin, a headache goes away. That's emergency treatment. I support that 100%. But then I want to say, why do I have the headaches? Maybe it's your glasses. Maybe it's the way you sleep. Maybe you're doing monosodium glutamate every day. We've done shows on headaches, but I'm going off on a tangent here. But I want to give you a short list of the to-do things that you can do to get on the fast track as quickly as possible to help balance out your hormones. There's a blood test called follicle-stimulating hormone. It determines if your pituitary gland thinks the ovaries aren't fully functioning. So what happens is follicle-stimulating hormone is released from the pituitary gland, goes to the ovaries release hormones, the hormones go up into the brain, into the pituitary gland. The pituitary gland says, okay, I can stop producing follicle-stimulating hormones. You just told me you're making hormones. Okay, sends a message goes back up to the pituitary gland, it slows down. If you're secreting a lot of follicle-stimulating hormone, that's a sign that your body isn't producing the right amount of hormones. So there's no need to do this if you've had surgically induced menopause, as you're menopausal by definition, and your follicle-stimulating hormone is going to be elevated. So if I remove your ovaries, the pituitary gland is going to keep producing follicle-stimulating hormones saying, hey, dude, where's the hormones? Well, you don't have ovaries anymore, you're not going to get the hormones. It's going to be naturally elevated. But the higher your follicle-stimulating hormone, the more likely you are that you're in menopause. So that's one way we can test to see if this is normal for regular menstruating woman. Follicle-stimulating hormones are higher. We're starting to see that it's not getting that hormone feedback. So a couple of things to start. It's what everybody wants. What do I do, Dr. Joe? What do I do? Here we go. I had to build up to it. I can't give you everything, It's our first date. We got to go slow here. Phytoestrogens. Taking phytoestrogens or plant-based estrogens before menopause can moderate the day-to-day estrogen levels, so when menopause comes, the drop won't be so dramatic. Where do we get phytoestrogens from? Plant-based diet. Weak estrogens block the stronger form of estrogens, and phytoestrogens can be found in soy. Okay, if you're going to do soy, I do recommend organic only. I do recommend fermented is better than non-fermented, but soy is okay because soy has phytoestrogen in it. Beans, all beans have phytoestrogen in them. So eating a plant-based diet is really going to help you tremendously. So the weak estrogens can block strong estrogen. So let's assume I'm exposed to a strong estrogen-like compound. Okay, these are hormone-disrupting chemicals. Where might I find that? If I'm eating animal products, animals oftentimes are injected with estrogen-like compounds to cause growth. And so if I'm eating commercial meats and dairy products and eggs, I may be getting exogenous estrogens, xenoestrogens, foreign estrogens, and they can be stimulating my estrogen receptor sites. Phytoestrogens block the estrogen receptor sites so these bad guys aren't being absorbed. Once again, another plug for a plant-based diet. Licorice and alfalfa are high in phytoestrogens as well, but it's got to be pure licorice, not candy licorice with, licorice flavor. It's got to be real licorice. Royal maca is an adaptogenic herb for menopause, and it's helped a lot of women as well. Be sure you avoid the inexpensive royal macas. You want to get the royal maca made in Peru. It's usually a little more expensive, but it's a good pure form. So the royal maca is what's called an adaptogen. Adaptogens are chemicals or herbs that can act like hormones. They kind of do what your body needs it to do. That's why Dr. Joe's adrenal support works so well. We have adaptogenic herbs in there that help the adrenal glands work well. Making sure you're getting enough omega-3 fatty acids. I recommend algae oil as the purest form of omega-3. It can be far more effective than fish oil. So the algae oil is going to be the purest form. And you want to stay away from the omega-6 fatty acids. The omega-6 fatty acids counteract the omega-3 fatty acids. So if you're eating a typical American diet, alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, you're getting a lot of these omega-6 fatty acids, which counteract the omega-3s, and the omega-3s is what's necessary to bring down the inflammation and help your body function normally again. So I take Dr. Joe's Vegan Omega-3. It's on the website, drjoe.com. I take it every single day because it's an essential nutrient. You have to get it from an outside source, and algae is the purest form. Green tea. Polyphenols are associated with lower risk of heart disease, and green tea, like royal maca, for example, matcha, M-A-T-C-H-A, It has polyphenols that can be more effective than those in red wine, and 17 times more antioxidants than even wild blueberries. So a good organic green tea is probably going to help you tremendously. One study showed that green tea can reduce the risk of breast cancer in younger women under 50, and now it's helping out with hormone balancing as we do the studies. So step one. What was our step one? Remember? Make sure I covered it here. Phytoestrogens, plant-based diet, omega-3 fatty acids, and green tea. That's what you want to do today. And if you do it all the time anyway, it's not a bad thing to do. Follow-up. Supplements. Black cohosh many times can help regulate body temperatures and hot flashes. So black cohosh supplement might be something you might want to consider. Eating organically grown foods, plants and fruits, vegetables, nuts, and seeds. A lot of studies have been shown that women on a plant-based diet segue through that natural phase of life called menopause with a lot less problems. So, of course, going to a plant-based diet is going to be huge. As part of a plant-based diet, I strongly advise the minimum supplements you take would be Dr. Joe's Super Greens and Dr. Joe's Essential Source. Those are 2 powders. They're on the website, drjoe.com. They taste great. The omega-3 fatty acids are going to be real important. B-complex is going to be really important at this point as well. And then a plant-based diet is going to help tremendously. We talked about exercise. We talked about the vitamin D. Make sure it's vitamin D3, not vitamin D2. On the website, drjoe.com, we have Dr. Joe's vitamin D3. That's the one. If I'm not out in the sun 10, 15, 20 minutes a day, that's when I take my vitamin D. So most days I'm taking Dr. Joe's vitamin D. 5 drops is the recommended dosage. That's 5,000 international units. Real quick, real easy, real simple, really important for the immune system as well. Some long terms. We talked about exercises already. Going to a plant-based diet. If you don't know what to eat, go to our website, drjoe.com. Type in, so what can I eat? We have a whole hour lecture on what we can eat. If you don't want to know what not to eat, you can type in the 7 deadly sins of nutrition and listen to the 7 deadly sins first, and then so what can I eat? The first book I ever wrote, Eating Right for the Health of It, is a great guide on what to eat. It talks about breakfast, lunches, dinners, snacks. There's a meal plan in there. There's recipes in there. So that might be something you want to consider as well, because that's a good guide as well. And then listening to our shows. Every show we talk about diet. There's never been a show that I've ever done in my entire life, and I've been lecturing now for probably 37 years. I've never done a show where I haven't discussed diet. So just pick topics that you want to on the website, listen to them. We have audio, we have video. On YouTube, we have a YouTube channel, which is the video. We have a Facebook page. Our Facebook page has a ton of videos on it as well, and you can enjoy that. Now, also, I want you to join our group called the Joe-It-Alls, JOE-IT-ALLS. It's on Facebook, and just join the group. Sierra's the one who moderates it. We got getting a lot of folks joining, aren't we, Sierra?
Got almost 200.
Okay, yeah. So that just happened in the past couple of weeks. And we're going to use you guys as our sounding board. We're going to ask you for topics, going to talk about supplements. So you guys are going to be our focus group as well. So you want to join the Joe-It-Alls. And then Sierra posts a lot on Facebook and Instagram every day, as a matter of fact. So if you're not following us on Facebook and Instagram, at Dr. Joe Esposito, do it now. At Dr. Joe Esposito, follow us, and you're going to get a lot more information than even just the shows do. Want to talk about hormone replacement therapy real quick. A lot of women ask me questions about it. I'm not a fan of hormone replacement therapy. Now, if you need it, I support that 100%. I mean, I don't like wearing glasses, but I have to. But my suggestion is this. Let's try everything else first. Let's try chiropractic care. I've found that a lot of people, when they have organ dysfunction or hormone imbalances, it could be due to a pinched nerve. The way the body works is the brain sends messages down your spine, out your nerves, to every cell in the body. So if you have a pinched nerve in your low back, you might have back pain, leg pain, hip pain, knee pain, numbness, tingling. But those same low back nerves control the colon, the sex organs, and the bladder. So for women, it's the nerve supply to the ovaries. And so by opening up the nerve and blood supply to the ovaries, many times that helps it regulate, and the uterus as well. For men, it's the nerve supply to the reproductive organs. So many times men come to me and things aren't working like they used to. And so I'd recommend they get on Dr. Joe's nitric oxide support. And every day men come in and tell me, Dr. Joe, thank you. So the nitric oxide support opens up the blood vessels, if you get where I'm going. But it also works for women as well. It opens up the blood vessels. So that's important. And so we get good circulation. We get the nitric oxide going in there. We get the nerve supply working properly. We get you on Super Greens and Essential Source, the omega-3s, the B-complex. That would be step one. Then we can go into supplements. We talked about things like black cohosh. And then, of course, we may have to go into other things as well. And that's when many times we jump right to the end game. We go to hormone replacement therapy. One of the hormones that's recommended sometimes is Premarin. Premarin is estrogen that's extracted from a pregnant horse's urine. Okay. Now we know it's associated with increased risk of heart disease. Because once again, nobody produces hormones exactly like you. We have bioidentical hormones, which we'll talk about in a second, which I'm okay with if we have to do it after we've done everything else. But with the bioidentical hormones, no hormone is exactly the same. My hormones are different than Sierra's, that are different than Garrett's, that are different than yours. So we're going to try everything first. But the Premarin is a horse hormone. Doesn't quite work the same. Estrogen therapy, again, which is extracted from the Premarin with horse urine, is effective at combating some hormone postmenopausal symptoms, but has proved some serious negative side effects such as increased risk of breast cancer and increased insulin levels. Once again, horses are different than you. At least get something your size. Horses are a lot bigger than you are. Provera, this is a drug, is a progestin or a synthetic form of progesterone, which probably makes it a little toxic as well. Again, I'm not a fan of synthetics if we don't have to. It could affect blood clotting as well. Once again, if you need them, I support that 100%, but my approach would be let's try everything else first. Long-term studies reveal many other negative side effects of hormone replacement therapy, including high blood pressure, vaginal bleeding. A year after millions of women quit their hormone replacement therapy, incidence of breast cancers fell dramatically by about 7%. So yeah, there's a pro and there's a con. But once again, let's try the natural approach first. Bioidenticals, unlike synthetic hormones or ones from animals, are natural hormones that are close to your own. So once again, try everything else first. If we have to, we can go to bioidenticals. The best way to take a bioidentical hormone, if you take it orally, that's perhaps the worst option because your liver then has to process everything after it goes through your digestive system and then into your blood. So it goes through a lot of steps before it can get absorbed. Hormone creams are alternative, but progesterone is fat soluble, so it can build up in your fatty tissues and lead to too much progesterone in the body. So once again, if you're doing the creams, the progesterone creams, not a bad way, but the best way is going to be sublingual, putting it under your tongue. It enters your blood system directly and doesn't build up in your tissues like the cream can. And it's also much easier to determine the dose that you're taking. And 1 drop is about 1 milligram. So sublingual bioidentical hormones, if you're going to do it, is probably the best way to deliver it. But once again, don't be fooled by commercials. And there's knockoffs out there. Natural estradiol, the bioidentical hormones, can't be patented. So there really isn't a big market for doing this. And sometimes there's going to be cheap knockoffs. And so you got to be careful with that. Other things. Menopause is an instance where what's easiest and what's best is going to be what's the natural way to do it is going to be the best way to do it. Prevention is always the smartest way to treat things, whatever it comes to, whether it's spinal arthritis. Patients come to us all the time and say, Dr. Joe, I was told I have arthritis. And I ask every question the same rhetorical question, and that question is, why do you have arthritis? And 100% of the time, patients say, I don't know, but I went to my doctor and they told me I have osteoarthritis. I explain that osteoarthritis is always mechanical. Bones are out of place, rubbing up against each other. Now, there's a little more to it than that, but that's the simple version. I had a patient come in the other day. She was a OBGYN, and we talked, and I just explained things to her. And as I explained our approach of opening up the nerve supply to the organs, and the nerves in the low back control the sex organs and reproductive organs, and doing supplement approaches, she, after about 10 minutes, and this always happens when I deal with people in the healthcare field, she said those 3 words. I love to hear every woman whisper in my ear, that makes sense. That makes sense. I finally get it. Now I understand that the nerves in the low back control the uterus and the ovaries and the sex organs and the testicles. And so a pinched nerve in the low back can affect the organs. Yes. And that explains why so many times we may not get all the results we want if we don't open up the nerve supply along with the other therapies. That's where chiropractic care comes in. So she was excited. Nurses and doctors make the best patients because we just take what they know and we spin it just a little bit and give them a new look on things. And they go, wow, that's really cool. I'm not fighting the health professions. I'm thinking we all need to work together. And the missing link is that many times they don't understand chiropractic and nutrition. And we add the chiropractic nutrition as another level or another layer of healthcare, and they get really excited. That's why we get so many referrals from the healthcare professionals, because they're things that they can't do, things we can't do. In our office, we'll be doing stem cells and PRP. I can't do that. I can't do injections, but nurse practitioners and medical doctors can, and we all start working together on that. So we'll probably do a show on stem cells and PRP real soon, as a matter of fact. So menopause is one of the instances where if you take care of yourself throughout life, you're going to have a lot less problems. We talk about shopping. Always shop around the perimeter of the grocery store. Anything on the middle is usually not good for you. Now, I have some canned organic vegetables in my house. I have some frozen vegetables in my house. And I have them periodically, but I try to eat something raw at every meal. And if I eat something raw at every meal, I'm going to be a lot healthier. And I'm going to take supplements like Dr. Joe's Super Greens, Dr. Joe's Essential Source, the B Complex, adrenal support. The adrenal glands produce your sex hormones. So it's the ovaries and the adrenals in women, testicles and adrenals in men. And so as we get older, the ovaries and the testicles don't work like they used to, but the adrenal glands can be fed. So I feed them with Dr. Joe's adrenal support. I make sure I stay away from stimulants like caffeine and alcohol and sugars and chocolates and teas and colas because that can stimulate the adrenals and burn them out. Super Greens and Essential Source, of course, the minimum supplements, the omega-3 fatty acids. We need to make sure we're getting the omega-3 fatty acids in your diet. So many people are deficient omega-3s. When we do a blood test on them, omega-3s and vitamin Ds, hey, that rhymes. Omega-3s and vitamin Ds are the ones that most people are deficient in. So make sure you do at least the basics. And all the supplements are on the website, drjoe.com. And if you want to make an appointment to come see us, I think you should. Because many times if we have hormone imbalances, you have to look at the nerve supply to the organs that produce the hormones, and the diet, and the supplements, and the lifestyle. And so you want to get everything you can together. And most people say, why didn't I do this sooner? Dr. Joe, I'm blown away that this is so simple, so inexpensive, so effective, no side effects. And again, nothing is 100% safe, but it's really almost no side effects. And they're blown away by the whole thing. And they'll say, why didn't I do this sooner? And then ultimately, while I'm doing my consultations, I would say 60% of the time, patients say, I need to bring blank to your office. Boy, could they ever use this? And so a lot of our patients are referrals, of course, because they get great results and they bring their friends and family in. So anyway, if you want to make an appointment, drjoe.com. You can do it right online. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. Our initial off visit used to be $375, but as COVID is going around, we've lowered that price to $149 because we want to have people get healthy. I can't say I have a cure for COVID. I have a cure for the flu. I have a cure for anything. But I can say if your body is healthy and you're eating a good diet, you're less likely to have problems with any disease. Doesn't matter what that disease is. So, causes of early menopause. I want to cover this real quick. I only got a few minutes. Sometimes women go into menopause early. Could be genetics. Your mother and your sister may be clues to it. Again, everybody's different, but there could be a genetic thing. Lifestyle. Smoking has anti-estrogen effects, and as the estrogen levels drop, that can lead into menopause. An analysis of several studies show that long-term use of smoking are likely to experience menopause sooner. So if you're a smoker, chances are you're going to, it's messing so much with your hormones, folks. I'm begging you, if you haven't quit smoking, that's probably the most important thing you can do, along with Super Greens and Essential Source, and other supplements, and a good diet, and chiropractic care. Body mass index, the fatter you are, estrogen is stored in the fat tissues. Women who are very thin have fewer estrogen stores, which can be depleted sooner. So extremely thin women may have an issue as well. Autoimmune diseases, even epilepsy, that can lead to issues as well with early menopause. So the bottom line is what I talk all the time about on almost every disease. Normally functioning nervous system, normally functioning digestive system, good nutrition. If you have neck pain, back pain, shoulder pain, numbness, tingling, chances are it's a pinched nerve. Might be something else, but it's the most likely thing that it is. And that's where my team of doctors are really good at getting people out of pain and making them feel good. If you're eating a bad diet that's loaded with foreign estrogens, xenoestrogens, that would be meat, dairy products, perfumes, hairsprays, carpet cleaners, new car smell. These are all estrogen-like compounds that can cause problems. So you might want to consider changing that. Go to our website, drjoe.com, type in household cleaners, household products. We've covered a lot of that in those topics as well. Minimum supplements would be Dr. Joe's Super Greens, Dr. Joe's Essential Source. That's the absolute minimum. Then for women, we can add women's hormone support, which is on the website, drjoe.com. If you're menopausal or perimenopausal, I do not recommend you take Dr. Joe's estrogen regulator. I recommend that for men because it helps keep your testosterone levels higher. For women that are in childbearing years, it's okay, but I don't recommend it for women in there that have gone through they're going through perimenopause or menopause. Nerve supply, of course, is everything. Eating plants that are high in nutrients and phytoestrogens, fruits, vegetables, nuts, and seeds, that's going to be the ideal diet. And the ideal diet really is a plant-based diet. It always has been and always will be. So if there was a better way to eat, I would be eating it. If there was a better way that if there's a better supplements, I would be taking them. So normally functioning nervous system, normally functioning digestive system, good nutrition. Follow us on Facebook and Instagram at Dr. Joe Esposito. Join the Joe It Alls. It's on Facebook. Any questions you have, go to our website, drjoe.com. Folks, I'm Dr. Joe Esposito. Thanks for tuning in today. Tell your friends about the show, and we'll catch you next time. Thanks for listening to For the Health Fit. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.